Hi there, my name is Joey and I'm the Manager of Clinical Services here at the MSPCA-Angell. Today we're going to show you how to give a subcutaneous injection to your pet. A subcutaneous injection is just an injection underneath the skin, so it's not into a vein or into a muscle. A subcutaneous injection example, most likely you'll be doing this if you're giving insulin. However, other medications can be given this route. Supplies that you would need would include your needle and syringe. For insulin, typically they're done in units, but if you're giving a different type of injection, they're going to be done in mLs. Follow your doctor's instructions as to how much to give. The supplies that you're going to need include that, as well as whatever product you're going to be injecting. Today we're just using sterile water, so that this way I can show you how to do that. Every bottle comes fresh with a new cap on it. First time that you use it, you want to take the cap off, and in the center is going to be a rubber injection port. That's where you're going to draw the product out. Each time that you use it, you do want to use an alcohol swab to clean the rubber stopper, so that this way you're not picking up any bacteria along the way. And then we can let that dry. With our patient, we want to go around where the shoulders are. We're not going to go to the back, we're not going to go to the head. Between the shoulder blades is the easiest place for us to give a subcutaneous injection. So I'm going to get my injection ready while my animal is resting. Each syringe is one-time use only, so make sure that you save them for sharp disposal. I'm going to use an insulin syringe, for example, today. I can remove my cap, and then I'm going to flip my bottle up. That allows gravity to be helpful, and it brings all my fluid down to the bottom. I'm going to draw up my assigned amount. If there's an air bubble, I can push it back into the bottle, and nothing bad will happen. I'm going to draw up to my assigned amount, which for my pet here is 15 units. I'm reading that from the top of the black part of the plunger. I'm going to remove that, and I can put that to the side. To give the injection itself, I'm going to use my thumb and my first finger to lift up the skin. That's going to form a tent. That tent is where I'm going. I'm going to go at a 45-degree angle into that tent. Using the plunger, I'm going to pull back. What should happen is that the pressure is going to keep that from pulling back too far. No air should happen because this is a stuffed animal. Air happened today. But there should be no air. If there's air, that means you went from one side through to the other. If there's blood, take your sample back out and try again with a fresh sample. I'm going to get rid of my air bubble now. I'm going to tend to my skin with my two fingers. Go at my 45-degree angle. Aspirate, meaning to pull back the plunger. Since I have no air, no blood, I'm going to push with my plunger on in. Afterwards, I'm going to recap my needle. I'm going to pet my pet. That does two things. One, it makes me feel better. But two, it allows me to make sure that it's nice and dry. If, for example, I went from one side to the other and went through with my needle, it's going to be wet. Contact your veterinarian if you're worried that you missed a dose or that the full dose didn't get into your pet.